Hello, my name is Brittany Owings and I'm a nurse practitioner student at Auburn University. My presentation is on the drug class thrombin inhibitors. This drug class includes the medication Pradaxa. This is the only medication that can be prescribed orally in this drug class. It acts directly on the formation of thrombin, preventing a blood clot from taking place. The pharmacodynamics of this medication is that it does act on the thrombin formation, preventing fibrinogen from being converted into fibrin, causing the clotting cascade to be stopped. The pharmacokinetics of this drug class is that it is absorbed in the GI tract, metabolized in the liver, and excreted in the kidneys. The distribution is unknown at this time, but the half-life of this drug class is 12 to 17 hours. The pharmacotherapeutics of this drug class include precautions for spinal tap or surgical procedures due to bleeding, as well as taking any other kind of anticoagulant. And also for patients that have renal impairment, you want to be cautious with. It's absolutely contraindicated in patients with heart valve replacements, as well as bleeding disorders, and it's a category X for pregnancy. There are adverse drug reactions with this medication, including bleeding, dyspepsia, abdominal pain, and anaphylaxis. The drug interactions included in this class are going to be any other kind of anticoagulant or antiplatelet medication. You do not want to use them concurrently, as well as PGP inducers and inhibitors. They can affect the absorption of this medication. The clinical use and indications for this drug class is to prevent thrombus formation, as well as prevention of strokes in patients with atrial fibrillation and myocardial infarctions. Monitoring with this drug class is fairly simple. You'll have baseline labs of a CBC, anticoagulants, liver, and kidney functions at the beginning before you start the medication. There is no monthly monitoring with this medication. You'll just get your routine labs at your next visit appointment. It does not have to be monitored periodically. The rational drug selection on this medication class is limited due to only one medication being in this class. And this medication can be rather expensive at around $400 a month. The education in this drug class is to educate your patients on the risk for bleeding and bruising. They need to know to look for bleeding in their stool and in their emesis, as well as nosebleeds or abnormal bruising. They also need to be educated on the need to use the original pill bottle because it can affect the medication, and they do not need to put it in a into a medi-planner. This medicine also needs to be used within 4 months of opening the box. If not, it needs to be thrown away. This medicine cannot be chewed. It has to be taken whole. And they also need to be educated on the black box warnings for this medication class, because there is a risk for hematoma formation with a spinal tap, as well as the risk for thrombolytic events if this medication is stopped abruptly. The main takeaways from this presentation is that this drug class is used to prevent blood clots. You want to educate your patient on the risk for bleeding. You also want to educate them on the need to use their medication within 4 months of opening the bottle, as well as using the original containers. And also on the black box warnings of the risk for having a thrombolytic event if stopped abruptly, as well as the risk for throwing a clot with a spinal tap. I have a little presentation of a thrombin inhibitor, which would be in this cup, and this is my little blood clot. So when the thrombin inhibitor is poured into the container with the blood clot, it slowly dissolves the blood clot. Thank you.